total knee replacement, 4.5 weeks post-op, near full knee extension. What we would do with the rapid release technology to help accelerate the outcomes and to do it in a way where we're not putting the patient through as much trauma is we put the patient in a hamstring stretch position. If you have a stretching cage, great. If not, just applying it on a chair or a table. We get the patient to floss the tension from the distal aspect proximally, okay? So pump the foot forward and back. Now we create a flossing technique for the gastroc, soleus, and then we take the rapid release technology and we apply vibration from the bottom up, okay? After 20 of those reps, then we're gonna have the patient go side to side. So rock the knees side to side. Now we're creating more of a proximal stretch hamstring. And then this is all helping accelerate knee extension without putting him through as much pain, okay? Good. And we can also apply any area that he feels a little bit of numbness or a little bit of scar tissue restriction, pain, we can apply the device to try to relieve that. The third step is to put his foot down just a little lower. Okay, now he's gonna lunge forward to his tolerance, nice and easy. So he's gonna rock forward and back so we get a little bit of hip mobility as well as forcing the knee into a little bit of flexion extension. Okay, so it's a mobilization technique to his tolerance. He's in the driver's seat. Okay, we can manipulate the posterior lateral hip, the hamstring, and even the soleus in this position to be the most productive and accelerated outcome and clinical experience. Just to add a little more flavor to his rehabilitation experience, but also to speed up the outcome for knee extension, what we can do is take a power plate if you have one. And just like we did in the stretching cage, what we would do is get the patient to rock forward and back into that stretch. And then now we got vibration coming from the floor up. We got active release with the patient going forward and back, and then we're taking the two sophisticated power tools, or one tool, and manipulating the whole posterior, lateral, and medial aspect of the gastroc, buying him more ankle dorsiflexion as well as knee extension. And this is how we're going to get his gait mechanics back up faster and also improve his level of discomfort. Okay? So the second step of using the vibration power plate is we're putting the patient with a total knee replacement in a kind of lunge position to get more of a soleus focus. And so what I have the patient doing is rocking forward and back into this lunge, and then the vibration from the floor up is creating this active release. He's active releasing it through this forward and back motion, and then we also take the sophisticated power tool, rapid release technology,